Yeah.
Good today.
Okay. All right.
Start. What
Okay.
you got?
I really don't have a ton. We are still in the middle of flu season. The majority of our flu cases are still influenza A. Typically around this time of year, we start shifting to influenza B. But the majority of what we're seeing still are influenza A cases that are coming in confirmed through the testing that we're seeing. We have a handful of B throughout the whole season, but our cases are also really hitting kids hard. So 0 through 18 years of age are the majority of our cases that we've seen all season. And so we do still have flu shots available. It's not too late to get it. And yeah, right now we're just kind of holding steady. We're not seeing a big, huge increase yet. We might, sometimes we get a second increase here in the spring. So.
Oh, I don't want to hear that.
I know. COVID cases are real low right now. We're not seeing a bunch of those. Mainly it's influenza at this time when people go get tested. And we have a tabletop exercise coming up on actually tomorrow morning. It's an infectious disease tabletop exercise that we do for our FEP grant. We have a bunch of partners in the community coming to that. It's in our back room from 9 to noon, I think.
Sorry, we'll not be able to.
Okay.
My daughter has appointments
Okay.
all day.
Um,
It happens, everything's all in one day.
yeah, it usually is. That's all right. We have that. You guys have any questions on what's going on?
Do you have any grant fund changes or everything's
Nope,
going good
everything's
there?
there.
Nothing with the shutdown, partial shutdown.
Nothing's been affected for us. I don't think, I think federal level WIC was funded fully throughout the end of their year. So if anything, if there is type of shutdown or anything.
End of what year?
Their fiscal year, which is October. And then nothing else has, or nothing's been affected. We're looking good on our grants. We're right about where we should be with spending throughout the year. So like WIC, we're about a quarter of the way through their fiscal year, and they have spent 30% of their funding. So right on. Well, they're a third of the way, through their year. And so that's right around where they should be. All of our other grants are looking good. FEP, we're halfway through the year with that. We're at just below or just over 50% spent, which is good. We want to make sure all of that is spent. And it's always completely spent because we don't get enough funding to pay for the one position that does. So, yeah, that. And then our pathways to recognition is moving forward. We are checking off the domains and the standards and measures that we're doing, submitting all of that to the state. They look it over, review it, give us some feedback on the accreditation board might be looking more for this, add a little bit more of this, which will be good. And then once we're done with that 2-year program, we plan on applying to the accreditation board, a public health accreditation board for pathways recognition to be recognized as.
We're coming up on that 2-year, aren't we?
Yeah, at the end of this, at the end of 2026.
Yeah.
Yep. And so once we apply for that, then there will be, I believe, a site visit where they come and look at our documentation. It's either a site visit like they do for full accreditation, or we just submit all of our documentation to them and they review it and make sure we have what we need to become a Pathways recognized health department. It's a lot of work, a lot of documentation, but it's
Are there very many of those throughout the state?
There, the Pathways recognized, there was a cohort, we're just the second cohort to do it.
Oh,
So the first cohort ended just right before ours started. And there was like 6 or 7 health departments that did that first cohort. So now there's 7, I believe, in our cohort now. The state health department in Helena is fully accredited, so it's not the pathways, it's full on accreditation. And then the larger health departments in the county, like state. So Lewis and Clark and Missoula and Gallatin, I believe, are all fully accredited. They have full-time accreditation coordinators that work on that. And
Wow.
yeah, it's a lot to do. So you kind of need that in order to become a fully accredited, because by the time you become fully accredited, then you start working on becoming re-accredited. So that one you have to continue to
So
show.
the pathways is the, like the first step, and then
The pathways is for smaller health departments to make it more realistic and in order to be able to do it, because we have health departments in our cohort. There's one who has 1.5 people working,
Mm,
you know, total in their health department. There's no way they could do the full accreditation work without it basically being there. Yeah. So the accreditation board, with feedback from health departments that have gone through accreditation or have tried to, then came up with pathways to recognition, which is about half of the domains and standards and measures that would be for full accreditation. And pathways is a one-time recognition. You don't reapply and become pathways recognized again. Once you're recognized as a pathways accredited or recognized health department. Yeah, and so it shows that you are providing the foundational public health services and the 10 essential public health services to your community, which every health department should be doing. Yep. We just had another opportunity for education for Bridget to apply to be an infectious disease certified nurse or certified public health professional. No cost to the county at all at this point. It's created through the National Board of Public Health Examiners. And it's a course that you go through, you study, there's many different domains of infectious disease, and then you sit for 120 multiple choice exams, and you have to meet a threshold within each domain of passing a certain percentage in order to get that certification.
Wow.
So she is planning on doing that, and that'll be a great asset for the health department and the community as well. That's where I got my national certification through, or for public health through, was the National Board of Public Health Examiners. So they're just coming up with different options and opportunities. So that's exciting, and it's at no cost right now. So.
Yeah.
And we have 3 people who are going to go to the Confluence annual conference in April in Billings. Myself, Bridget, and Laura will be going to that. We are undecided as of right now if Laura is going to take the pool certification course to be a pool this year, or if she'll do it next year. But they are offering it in conjunction with that conference. It would be an additional day for her down there, but we're mulling it over. She has until April 9th to register. So.
We'll not be able to attend that.
Okay, sure.
It's just a lucky year.
That's okay.
I really enjoyed last
Yeah, it's a great conference. And they have some additional stuff for Board of Health this year. They've been asking on a lot of public health calls throughout the last few months of like interested, like what should we teach and what all of that. So that's exciting. Oh, the .gov emails. Do we have to move?
eventually everybody will need to, yeah. And it's gonna, there's no like hard deadline for it, so it could take a little, we know it's good, and they know it's gonna take a while, but I would say we need to have everybody. And the only reason that those other 2, when I sent out that email,
Yeah.
because we weren't sure how things were set up yet with the COA, because I didn't want to
Yeah,
I didn't want them to freak out, Sherry and Mel, them to freak out that it was gonna happen right away. And then the sheriff's department, they already have a whole different setup with their email. But I think that we all need to eventually.
Why do we have to?
yeah.
Well,
I guess I'm
we've
not
already,
clear on that.
because we've went over this last year, we started it and everybody agreed to it. And so I think that we need to be consistent, I think, within our emails if at all possible.
There's a
But
lot
we
of
don't-
counties that are not consistent
Two.
with their emails. I will tell you that.
Mhm.
There's a lot that have .us, .org, .gov, all within their same county.
Yeah.
Our issue and basically the concern is everything that we log into statewide is our email. And we will have to reset every single thing that we have done. The state infectious disease system, Medicare and Medicaid will take us months to
Mhm.
fix. I mean, to get them to do anything quickly, it just doesn't work.
And I don't think the sheriff's office would be changing over.
No, that's what I said. No, they already have a step. They already have their email's already different.
What's their setup though? So if .gov is because it's more secure, why would you not want the sheriff's department? And unless there's like just as secure, is there something we could do for ours to make it more secure? Like, it would just be very helpful. Cause I still get things forwarded from my co.hill.mt.us one. And that was when I first started in 2010. So, I mean, it's
Yeah.
just, I would, if at all possible, like to keep my health department at .us. For the work that it will be to switch all of our logins and all of WIC just had to go from .gov back now to .us. So now they'll have to go back to .gov. Which doesn't make sense.
Well, I would
that
say
the state would be okay for them to go from
I
.gov
guess
to
the .us, I guess if you need it for those things, but I would suggest in a normal email, you set it up. I don't know if we could set it up where you still have a .gov email that people, but I don't know. My thought, when we talked about this last year, was that we were gonna transition everybody but the sheriff's office over.
I think that it was not discussed.
I don't
with
think it was
everybody.
I was just gonna say, I
I
don't
think it was discussed with clerk and recorder.
very heavily.
And she wants it, and if she wants it for elections.
Yeah.
I don't see the issue with her getting it.
I guess
That's-
it's,
they
they'll
don't want it.
continue to talk about.
I mean, I understand like for the courts, they're under .gov too, because of their state
Cause they're
program.
state, yeah.
That's how they're set up. So it won't be a change for them. And I understand Lexi's side of it.
Mhm.
I don't think it was discussed. That we had.
It makes sense to have everybody as a government entity to have a .gov. I mean,
But we're not.
logic.
But we're not.
We are not a
county.
government. We're not government.
No,
We're county.
everybody won't be that way is my point. Your sheriff's department won't be that way.
Yeah. What is there? There's this Hill,
We're county. We are not.
Hill SO something or other.
There's
Yeah.
.org, yeah.
Yeah, it's .org.
And it's secure and they've never had an issue. Well,
Until this week.
until this week, I don't think.
Places they have issues. The city. They had that issue.
Oh, I didn't get any.
Yeah, there was things
With-
sent out.
Are they under .gov?
They're like CI
Oh, CSI or
or
SC?
CI, I don't
Like
even
that,
think it's
yeah.
interesting. The city of Haver. CI. It just seems
CSI.
like it's very strange. And if we can stay at .us for my health department, I would appreciate it. I mean, WIC at the state level kicked our people off of the state system. They had to change from their system, which was .gov, and they
.gov.
changed to .us. And so if there is an
Yeah, it's in the
issue,
treasurer's office.
yeah, I would think that,
I thought they didn't have it at mt.gov. Is that what theirs was?
yeah, they were at mt.gov.
They changed that. Why is that?
The state kicked them off of their system.
The same
just
thing
like the
happened with the
treasurer.
treasurer. That's why Sandy's so upset, because if she's gonna have to go back to .gov after they just switched her off of it, it's gonna come.
Well, that was
things
more
again.
through the state, not .gov. That was the state system that they were getting rid of them. Maybe that
But
was the same
still,
thing.
if her
with WIC.
email is a .gov, and they weren't
It was
accepting
at
that. previous.
mt.gov, which is not just a .gov, but it was the state system. So that must
Yeah,
be the
it was
same
their
thing.
state
They were
email.
eliminating,
It's,
yeah.
it's just like your court system. They're at mt.gov as well. But I guess my point is the state, when they kicked them off, didn't say it needs to be another .gov email in order for it to be secure. They said it needs to be your local email. So, I mean, .us, we have the Duo fob, we have, I mean, I don't know. If it's at all possible, I would just like to stay at .us for my department. I know there are other counties that have different emails throughout their different departments as well. If it's possible.
So, yeah, well,
Okay, well, and DIS calls me today because they called me yesterday and I said, no, you're not doing it right now because I have to talk to my commissioners. I'll just tell them that
we're
we're
discussing.
holding off right now. You can go to a different department.
Nobody's called me yet.
Hmm?
Nobody's called me yet.
It was he was like, I'm calling to switch over. And I was like, no, we're not doing that in my department right now. So
I'm like, we're gonna have to change all of our business cards,
we'll have to change
Everything.
everything.
and I just got a box.
I think for right now that you can still keep, you don't need to worry about changing your business cards until you run out at that particular time. Cause they're still getting, right now, it's still gonna be forwarded from your .us one
They're gonna forward.
for now, yeah. I got a call DIS cause somewhere over the weekend I lost access to my email on my work phone. Which is weird because my calendar stuff still shows up. But I can't get into my email.
Mark used to have that issue a lot.
Same phone.
Oh,
It's the
maybe.
phone.
He used
Maybe.
to have that issue
Could
a
be.
lot. It seemed like we always
Well,
had.
Mark's like me, I know enough to be dangerous.
Yeah. I mean, if we have to eventually, I understand, but if it's at all possible, I would like for us to stay at that. We have our environmental health email, we have a communicable disease email that is connected to the hospital system. All of that will have to change as well, so. Just something to think about. I don't think I have anything else really. We have nursing students over there today. From MSU Northern, had some yesterday. I believe hockey is done for me until April. There's tryouts begin in April first.
It's not very
First
far.
hockey. No, it's not. I know. Everyone's like, when does it end? I'm like, well, they're still practicing now. We have no more games, but then there's tryouts in April. Starting all over, so. But it was a good year.
Did well.
Yeah, they did good. His Wolves team went down to Phoenix and won, actually.
Oh,
They
cool.
won their division. They were, yeah, it was awesome. They lost their first two games and then back and won 4 in a row to win the championship, beat the two teams that they lost to. So that was great. And then his Ice Hawks team just had state last weekend and they got third. They went in fourth and got third. So
Oh, wow.
yeah, they played really good.
Good.
The top 4 teams were very close. It was Missoula, Bozeman, Helena, and us. It was kind of whoever decided to show up, would win. And we played Helena, went to overtime, and lost in overtime, but it was good.
So you wanna continue on playing like into college and
Oh, he
everything?
would love to, yeah. So we'll see.
Can have it as a college sport?
Mhm. So MSU Bozeman has, the Bobcats have a
I
hockey
didn't know
team.
that.
Yeah, so they're not like sanctioned
Kind of a club type team.
more, but they play D2 and D3 hockey in NCAA. So they're going to nationals. They've
Oh,
gone
wow.
a few times.
Gary Kewen's daughter played a couple years ago in there.
Mm-hmm. And then, yeah, and they have women's hockey too. So they have men's and women's at Bozeman. U of M has hockey. Great Falls does. Providence has hockey.
I did.
Yeah, it's
Never
all
heard of
over.
it
And then,
before.
yeah, and then of course out of state. But in Arizona, we got to play at the Arizona State University rink, but it was their practice rink. It was big. Really nice. Yeah. That's what he wants to do. And then last night Caden had his concert and it was an amazing concert.
But it was great.
It was so good. It was all about mental health and I emailed them and I was like, I think you guys should have this provided for every student in Havre Public School as like a mental health awareness presentation. It was so good. So it was fun.
I liked when Bradshaw was doing the 93% and the
Yeah.
100%.
I know. He was talking about in class a 93% A, but in music, 93% sounds terrible. Does not sound very good, right? They always have to strive for 100%. So they played a portion of the song 93% of the notes correct. And it didn't sound, I know it wasn't horrible, but it didn't sound like it
No.
did when they had first played it.
I never ever thought about that before until he brought that up.
Yeah, yeah,
Yeah, it just takes one person to be off.
yeah. So it was really, really great, I thought. Very impactful.
Every time I go to something like that or a Montana Actors Theater play, I thought, yep, there's more people that have way more musical talent or acting talent than me, but they need people like me that'll just watch.
Yep, exactly. Oh, yeah, definitely. My son is way more talented than me, but I'll go watch him any day. So. All right.
Okay, well, thank you.
Yeah.
All right, well, adjourn the meeting.
Thanks. Have a good day.